Welcome to the ACMG Knowledge Nugget on newborn screening for Guanidinoacetate Methyltransferase, or GAMT deficiency. This activity is intended for educational purposes only. Neither I nor the Planning Committee have any disclosures. This session is approved for 0.25 CME. To obtain CMEs for this activity, you will need to pass the quiz with a score of at least 80% and complete the evaluation. This session is a companion to the GAMT Deficiency ACT Sheet, which is freely available at www.acmg.net/ACT. ACT sheets are intended to be immediate resources for providers who encounter positive newborn screening results. Please keep in mind that a newborn screening result is just the first step in the diagnostic process. Further testing and evaluations are needed to determine if the newborn has the disease, a true positive result, or is unaffected, a false positive result. The ACT sheets are intended to provide an overview of the diseases identified by newborn screening and clear next steps for the management of a positive newborn screening result. This session will cover background information on GAMT deficiency, including clinical features and the underlying genetic cause, actions a primary care provider needs to take upon receiving a screen-positive test result for GAMT deficiency, clinical considerations, and supplemental resources. GAMT deficiency is a very rare inherited disease caused by pathogenic variants found in the GAMT gene, which leads to a decrease in GAMT enzyme activity. This decreased activity impairs the synthesis of creatine. Without creatine, the body is unable to use and to store energy, and this affects brain and muscle function. The age of onset for GAMT deficiency is typically between 3 months and 3 years of age. Initial signs and symptoms include developmental delays, hypotonia, seizures, and behavioral issues such as autism and self-injurious behaviors. GAMT deficiency is inherited in an autosomal recessive manner, meaning that only offspring with a pathogenic variant in both of their GAMT genes will be affected. Parents with a child with GAMT disease are carriers and are unaffected, but have a 25% recurrence with any future children they have together. At this time, not all states provide newborn screening for GAMT deficiency. A good resource for checking a state's newborn screening panel is the newbornscreening.hrsa.gov website. In the states that do screen for GAMT deficiency, testing is mostly accomplished by examining levels of guanidinoacetate, which is increased, and levels of creatine, which is decreased in individuals with GAMT deficiency. Now that you have an understanding of what GAMT deficiency is, let's talk about what to do if you have a patient screen positive for GAMT deficiency during newborn screening. You will need to take the following actions. First, contact the family and do the following. Inform them of the newborn screening result and that more testing is needed to determine if their child does or does not have the disease. Ascertain the clinical status. No clinical signs are expected in the neonatal period. Provide the family with basic information about GAMT deficiency. Second, take a family history. Because GAMT deficiency is inherited in an autosomal recessive manner, it is common for there to be no known family history of GAMT deficiency. Third, arrange a referral to a GAMT deficiency specialist for genetic counseling, a comprehensive clinical evaluation, and discussion of treatment options. The specialist is typically a pediatric geneticist. The clinical evaluations should include a comprehensive physical assessment by the specialist. Fourth, working with the appropriate specialist, take steps to ensure biochemical and/or molecular confirmation of the newborn screening result. Confirmatory testing includes guanidinoacetate analysis, creatine and creatinine analysis, and GAMT gene sequencing. Fifth, report the final diagnostic outcome back to your state newborn screening program. Treatment for GAMT deficiency promotes normal growth and development through increasing creatine levels and reducing guanidinoacetate. This is achieved through creatine and ornithine supplementation, dietary protein restriction, and sodium benzoate to help reduce glycine levels. As you continue to care for your patient with a positive newborn screen for GAMT deficiency, it is likely additional questions and concerns will come up. Here are some resources where you can obtain information on GAMT deficiency, appropriate laboratories and tests, and genetic specialists. Before we end today's session, let's have a quick review. First, GAMT deficiency is a serious condition, and identification of affected individuals is essential for administration and benefit of early treatment. Second, ACT sheets are freely available on the ACMG website to review in the event of a screen positive result. In addition to GAMT deficiency, ACT sheets are available for many other conditions that can be identified through newborn screening.